There's more to universal health coverage than health for all. UHC is critical to protect the right to health of people impacted by conflicts. It is key to coping with climate-related health threats. It is the gateway to ending poverty, achieving gender equality, and building peaceful, secure, and inclusive societies. This election, we must make UHC based on primary healthcare a political priority. Urge your political candidates to commit to advancing UHC if elected. With your advocacy and your vote, you have the power to drive real change. Vote for a healthier, fairer world. Vote for UHC.
Welcome to this global webinar on getting UHC on the ballot. My name is Eliana Monteforte, and I'm the Director for Special Projects at Global Health Council. I'm also an advisory group member of the Civil Society Engagement Mechanism of UHC 2030, and I also serve as the Civil Society representative on the UHC 2030 Steering Committee. So with elections taking place in 40 different countries this year in 2024, and many of these countries have some of the largest populations in the world, this is a pivotal moment for advocates to ensure future leaders keep health and particularly UHC high on their agendas. So to that end, we've prepared what we hope will be a useful program for advocates worldwide. This webinar will include 3 parts. The first will provide an overview to a recently launched election advocacy guide, which is called Getting UHC on the Ballot. The second part will include a panel discussion where you'll hear from in-country advocates on advocacy successes, challenges, and lessons learned. And we're also going to be hearing from an honorable Minister of Health to get some public sector perspective on elections. And lastly, we'll provide you with an overview of existing UHC 2030 resources and data that can help shape the asks and the advocacy that you're already using and base them on evidence. Before we get started, I have some logistics. So today's webinar will be recorded, and the recording and the PowerPoint presentation will be shared after this event. And then next, we currently have interpretation available in French, Spanish, as well as international sign language, which you should be able to see on your screen. To access interpretation, if you go to the bottom of your Zoom screen, you'll see a globe that says interpretation. If you click that globe icon at the bottom of your Zoom screen, you can select your language of choice. So to begin our program, I'd like to introduce Paloma de la Cruz, who will be providing us with an overview of the UHC 2030 Election Advocacy Guide. Paloma is currently the Communications Manager at UHC 2030, and Paloma, I'm handing the mic over to you.
Thank you, Elia, and welcome everybody. It's my pleasure to share this new election advocacy guide with you. I'm just going to share my screen so that I can walk you through the overall tool structure and some key messages. Right. So hopefully you can all see my screen now. Yes. The first, before I go into the key messages and the tool itself, I wanted to talk a little bit about why we created this guide and why now. First of all, as you may know, by consistently engaging in the electoral process, we as advocates, as UHC advocates, can influence the selection of policymakers who are committed to prioritizing and investing in health for all. And by engaging over the long run, we can make healthcare a recurring and prioritized electoral issue. As Eliana mentioned, there are a myriad of elections taking place this year. So this is a unique opportunity that we have to make sure that future leaders keep health high on their political agendas and take meaningful action towards universal health coverage. The Election Advocacy Guide outlines 6 steps that advocates can take to ensure that UHC is included in political election agendas and campaigns. I'll walk you through the guide and the key messages, but Please keep in mind that these were general guidelines drafted for a broad and global audience. Not everybody, not every suggestion will apply or be possible in every single context. So we ask that you use your judgment and reach out to civil society organizations in your country when in doubt. In terms of the structure, we have an introduction here, followed by a section with the 6 steps that we recommend to get started. We'll get into these shortly. At the bottom of that section, there's a short feedback form, which we welcome you to use. And that's followed by a resources section with resources to help you draft messaging. There's also a table of upcoming elections that are sorted by country, the type of election, and a section with context for each country. We're working on making this an interactive tool. For the moment, it's a simple list. So we hope you'll find that useful. Now, if we take a closer look at the content in the introduction, we provide a bit of background about the tool. Here you have our contact information, where we welcome you to email us. In addition to the feedback form, you can also provide more detailed feedback on your experience using the tool and engaging in the electoral process in your country. There's a PDF version of the guide available, and this is a form that you can fill out to add your organization to the list of country contacts. So we welcome to use that as well. As I mentioned earlier, the tool is broken down into 6 steps. For each step, you can click on the accordion tab to view the details. I'll walk you through some of the key messages for the first step, which is identifying your target audience. This section is about determining who you wish to engage with according to the elections taking place in your country. Here we focus on presidential and legislative elections, since these are the ones that typically shape a nation's policy direction, laws, and national budgets. But this guide can also be adopted and applied to regional and municipal elections, of course. To influence political candidates, you can engage on many levels, either by reaching out to candidates directly, through campaign managers, political consultants, party leaders and officials, and even family members. You can also advocate within parties to influence the development of party agendas and priorities. CSOs, NGOs, media outlets, and academic and research institutions can also have a significant influence. So it all really depends on your strategy. For instance, are you reaching out as an individual or as part of an organization? Do you have any direct or indirect connections to the candidate or to people who are close to them? Once you've identified your target audience, it's time to prepare your messages. It's important to tailor your messages to the candidate's campaign platform, and you want to have a clear ask. For example, you might ask the political candidate to prioritize increased funding for the healthcare sector if they're elected. Be sure to tailor your ask to the context in your country, including the healthcare challenges, and to the candidate's platform. One example we provide in the tool is suppose you have a candidate whose campaign focuses on job creation. In that case, you can frame your key messages to highlight how UHC can contribute to employment by keeping workers healthy and productive. Of course, you want to use evidence-based arguments to make the case for the benefits of UHC and to emphasize how UHC can help them win votes. The tool provides other general guidance, including using plain language and sharing your personal story to connect with candidates and to make the issue more relatable. You might consider, especially as an organization, creating a publication or a briefing paper that you can leave with your target audience. The tool provides suggestions on what to include in this publication. And there are links to resources to help you draft the messaging as well. Once you know what you want to say and you have your publication, it's time to prepare your elevator pitch. This is a brief introduction that you can say in under 30 seconds that you know by heart, to share your key message and to grab the attention of your target audience. It's important to keep a politically neutral stance because the issue of healthcare, as we know, affects people across the political spectrum, and you don't want to alienate a particular group. Keeping a neutral stance will also allow you to work with policymakers from different political parties and to promote inclusive and constructive dialogue in the long run. The tool does not provide specific messaging because much already exists. We didn't want to reinvent the wheel. And the messaging would need to be adapted to your specific context either way. But we do link to resources you may be familiar with, such as the Action Agenda, the UHC Data Portal, CSCM's country consultations on UHC, and certain sections of the Health for All advocacy toolkit. Let me just close this section. The next step that we recommend is engaging your target audience. So you have your target audience, you have your messages, you know what you want to say. Now it's time to reach out. You can find contact details for political candidates through online search engines, on official campaign websites, and at local party offices, for example. And you can attend campaign events and town halls to request contact information. Whatever you do, it's important to use official and reliable sources and to respect privacy and adhere to ethical standards. There are also many ways to engage with political candidates, especially if in-person engagement seems intimidating. So you can send formal letters or emails, you could share your stance on social media, make phone calls, or participate in town halls or public forums. You can also engage as part of a broader group with other UHC advocates. Their strength in numbers and working in a group ensures that we're all speaking in a unified voice. There's a section here about what you can do if engagement is discouraged or not possible in your country or political climate. This includes raising a public awareness about UHC and collaborating with religious organizations or community leaders to broaden the base of support. As mentioned earlier, the guide was drafted for a broad global audience, and some of the suggestions may not apply in certain contexts. So we encourage you to use your judgment and to work with civil society organizations in your country. Next, you want to amplify your message. Once you've reached out, ideally multiple times and through multiple channels, you want to make sure that your message gets out there beyond the people you've contacted directly. Again, you want to ask yourself what's possible at your level. Maybe your organization can organize or participate in conferences and seminars, create petitions, or lead public awareness campaigns about the importance of UHC. Or maybe it's a matter of sharing your views online or engaging with the media, such as through opinion pieces and interviews. Whatever you do, know that you don't have to start from scratch. This tool provides links to resources such as the UHC Day Toolkit, which can always be adapted to your needs and context. The next step would be to document commitments and campaign promises. This is about keeping track of the promises the political candidates make in order to hold them accountable if they're elected. You can refer to campaign websites, social media platforms, and speeches or debates and interviews, and take notes of any promises related to UHC so that you can then use those as a benchmark to measure their performance once elected. And finally, follow up after the election. It's important to monitor leaders' actions and policy decisions and to compare them to campaign promises. You can also engage in ongoing dialogue with elected officials through meetings, letters, or public forums to express your concerns and emphasize the importance of fulfilling UHC commitments. And be sure to engage with your parliamentarians as well. They're the ones who draft and pass the laws, approve the national budgets, and oversee the executive branch to ensure policy adherence. They bring your voices into the legislative arena and are key to ensuring accountability. We also want to emphasize with this tool that the work doesn't stop once elections are over. Staying involved after national elections and actively participating in midterm and local elections are crucial if we want to create lasting change. So we hope you'll find this tool useful. As mentioned earlier, each section links to relevant resources. So we encourage you to take a look and to take what you need and what makes sense for your context. We'll continue to build on this based on your feedback. So please also write to us or fill out this quick feedback form on the bottom of the page. Finally, we encourage you to fill out the contact form if you want to add your organizations to the contact list and to promote the tool and the messaging with your networks and on your social media platforms. Together, we can keep UHC high on political election agendas and campaigns and make health for all a reality. Thank you.
Thank you, Paloma. I'm going to pause now to see if the audience has any questions regarding this elections advocacy guide. There are two ways you can ask questions. You can either type your question in the chat box, or you're welcome to raise your hand. I'll call your name and you can unmute and ask your question. I'm going to pause for a second. Any questions? And while we have people thinking about questions, I did just want to to stress that this toolkit was actually developed based on existing resources that UHC 2030 and the civil society engagement mechanism have developed in the past, many of which we've developed in collaboration with a lot of you, with a lot of our civil society members, a lot of our CSEM membership. So you'll see a lot of the resources that Paloma have shared directly linked to some of those resources. And of course, as Paloma said, we would love to have you all provide more inputs to this tool. So as you spend time looking through it, if you have any kind of suggestions that might improve the tool, anything for us to consider, please submit those in the page that Paloma has shared with us. And I see that Laura has shared the link to the advocacy guide. So you can see that in the chat if you all would like to click on that and scroll through. And the only other thing that I would say as you're thinking through how you want to do advocacy, either in the lead up to elections or as part of election campaigns, is to always make sure that you're abiding by your country's election laws. I think that's really important because it's very different based on what country you're in. So please, use this as a resource, but also make sure that you're aware of your election laws. Any questions? I'm going to give it another few seconds to see if anybody wants to break the ice and raise their hands. Okay. It looks like people are introducing themselves in the chat. Thank you very much. Welcome. Okay, so we will have another time for question and answers, and this will be after our panel discussion. If during that Q&A you all happen to have questions about the election guide, I think it's perfectly fine for you to ask those. But with that, let's move on. So we're now moving into the second part of our program. And I'd like to introduce our 4 panelists today, beginning with Ravi Ram, who is the Director of Evaluation at MedWise and a health system specialist. We also have Kurt Frieder, who is the President of Fundación Huésped in Argentina. We have Smita Sadasivian also, who joins us from India and is the Senior Advisor of Inclusive Health Policy at Disability Rights India Foundation. And lastly, we have the Honorable Larry Yonkwa, who is a Member of Parliament in Liberia. So I have very similar questions for our first 3 speakers. The first will go to Ravi, and that's, how did you succeed in getting UHC on politicians' agendas before, during, and after elections in Kenya? And Ravi, if you can also talk about some of the successes that you experienced, some of the challenges that you might have faced, and any lessons you learned along the way. Over to you, Ravi.
Great. Thank you very much, Eliana. And welcome to everybody. A quick request, if I can also go on video. There we go. And can you see me now?
Yes, we can see you.
All right, great. I've got a very brief set of slides just to share with you. Hopefully you can see those as well, right?
Yep, they're on the screen. Thank you.
Excellent. So we'll go ahead. Yeah, as Eliana said, we're going to look at a little bit about the activities here in Kenya before the recent election. That was in 2022, so just a year and a half ago, what we did during the elections and what we're doing after the elections. So very big, just a bit of the context. Health has been on the agenda for, health's been on the agenda for quite a while in Kenya. And in 2017, with the previous government, it was part of the Big Four agenda. And so that was actually a remarkable step forward. And that is credit to a lot of civil society as well as other groups, academia, media, and others in really pushing things forward. So the government here in Kenya launched its UHC pilot at the end of 2018 on UHC Day. which coincides with Kenya's Independence Day, just as a coincidence. What kept things very active was that this UHC pilot actually failed. And we have 47 counties in Kenya. 4 of the counties were the pilot. One by one, each of the county governors dropped out of the pilot. And by the end, you can even see here at the bottom, one of the key UHC advocates just said that, no, it didn't work. And so that was very important to have that civil society voice signing off, where the government is trying to paper things over and say, we're going to take the lessons, relaunch, etc. We didn't want that. We needed a different kind of system. And that happened actually just as the election season was starting off. And so that was very important for us in Kenya to be able to say, yes, we've made an attempt, and why didn't it work? So the nice thing is that kept everything moving very, very strong. But as you can see over here, we didn't have a lot, despite a high demand for reforms, we don't have a lot of social accountability. And so as much as I've put in here just a few little media clips, what's going on? And let me just see if I can, whoops. What happened over here is that as much as politicians were talking about UHC or health reforms, they weren't backing it up with money. And part of that is due to the contest between the central government and the 47 counties. Health is being pulled in different directions as Kenya decentralizes a lot of its public services. Health is a big contest, and this is just something about the context here, because there's so much money there. And so the central government was trying to squeeze the counties by reducing the budget allocations, and we had to fight that, as well as looking at how we want to move things forward. So in 2022, we had the elections. And so we in civil society had to have our own internal debates about what do we want for UHC. And that was in the context of a nationally accepted failure in the first UHC rollout. We had discussions with media, and that was very important because newspapers want to fill their pages or get space filled on TV. And they're not necessarily health experts or any topical experts. They really just want something that can keep people engaged. And so helping shape what the media talks about was very, very important for us. And the other point was that we found getting academia involved. And Kenya's got a wide range of universities. The government turns to the universities for technical advice. They don't always come to civil society, even when we are very active ourselves. So they turn to the academia, and getting academics to take a non-technical point of view, but actually let's look at a broader perspective. And let's see how we want to get not just health financing or the service package, defined, but let's also see, what do we mean by health rights? What does that mean for marginalized populations or refugees who see Kenya as a home? So a lot of those kind of discussions had to take place. And the net result was, even as the previous government wanted to cover up its failure, we were able to keep health as a priority. The nice surprise is that the current government is picking it up. And that's credit to the government in many ways, because the government's fingers have already been burned once in the previous administration. But we're seeing now, and this is something that draws lessons for us, they're doing it not for public interest, but for their own interests. And that's very much linked to the government having ties to private sector and commercialized health services or the insurance companies. So we're seeing less emphasis on primary healthcare, no emphasis on equity, but all about health financing. And I've put in 2 pieces over here. One, this is a tweet from the Kenya National Assembly, and they actually, the digital health bill, and you can see the social health insurance bill, which is the new form. We're on version 3 of UHC. They reduced the public debate from 14 days by law to 3 days. Basically, they were trying to rush it through before anyone had a chance to review and digest the bills. And another civil society group, hats off to them, they went to the courts, and they actually had the implementation of that bill suspended to buy us a little bit of time to start reviewing what's actually underneath all of these bills. They've come out with, the National Assembly has now come out with regulations. The Ministry of Health is looking at rolling those out. There's further, the government has recognized they need to involve civil society. And so they're very much making sure that they at least adhere to the 14 days that's required by law. So here we are. I'm just showing a little bit about how we are reviewing what do we want to see in the draft primary healthcare bill as well as the social health insurance bill. You can see clips of some of the memoranda that were submitted by various civil society groups. And I'll just give a call out to Amnesty Kenya and to the Health NGO Network here in Kenya, because they're very instrumental in working with all of us in bringing civil society together. And that's really important because in previous iterations of UHC in Kenya, civil society was divided, largely because some civil society groups were getting funded to do the work of the government. And even as they had their own misgivings, they did not bite the hand that feeds them. And they went ahead and implemented something that they would behind the scenes say, we don't know that this is going to work, but we have to do our job. So now we're building up a more united front on civil society and academia, feeding that through media and keeping things going. So to wrap up a bit, some of the lessons that we have, and this is very much linked to the guidebook that's been produced by UHC 2030 and CSEM, we need coalitions. If you're working on your own, you're going to have a lesser impact. And the strategy we used was to come together, agree on this is our consensus, but each civil society coalition or partner would be able to come up with their own perspective. But coming together was very important. Next, as I've mentioned, very much stay involved with the media and academia. That means just finding out who's writing media articles in your country, and then just get them. They typically have their not only name, but email address in their publications. Just invite them. Something that we find very critical for keeping media engaged is invite them to a breakfast meeting. That makes sure that they show up. For academia, it's a little bit harder to get to them, but once you've had that meeting, that it works. Being visible to government. It's not just being in the streets or getting the media, but it's also very much having that backdoor channel to a few people in government. So you've got multiple ways of government hearing you, not just through the typical civil society piece, but also that they see that you are active and that you're willing to sit down with them and have a discussion. And here's where we didn't get enough done, defining criteria for health reforms. What does UHC really look like? We need to do that. And we're doing that after the election now because we missed the ball. And as much as the country was prepared for a unified message before the election, we weren't ready to come together. And specifically what we're working with now in Kenya is framing universal health coverage, not only in terms of financing of health, which is where it's being driven, especially when World Bank funding is involved, but to get it in terms of health rights and health equity, because that really makes sure that the universal and the health aspects come out and not just the coverage. So with that, want to say thanks very much and happy to stay on. I'll be with this webinar throughout, and I'll be watching the chat and happy to answer questions otherwise. So back to you, Eliana.
Thank you so much, Ravi. I think there was a lot of interesting information you provided us with. I think the first is how important it is to invest in health, especially when we're talking about UHC. And this really does translate to a lot of what's happening at the global level, because we saw in the high-level meeting on UHC, which happened last year, that the whole aspect of investing in health in the political declaration, which is the outcome document of this high-level meeting of UHC, was actually kind of weak. And so I feel like it's really important to stress some of these country examples to really reiterate how important it is to invest in health in order to reach universal health coverage. And then I love how you talked a lot about the collective voice and how powerful civil society can be when we come together and have a united front and, develop common asks together. So that's really great, and something that I think the civil society engagement mechanism of UHC 2030 tries to do in a lot of ways. And I really encourage all of civil society at the country level to do that as well, because we're stronger together than apart. And then I really also love how you stressed know who your influencers are when you're doing your advocacy. In this case, it was the media and academia. But just to stress how important it is to do your stakeholder mapping and to know, maybe if civil society isn't particularly in your country, influential with your government, find out who is and talk to those people and make sure that they're part of your campaign. And the last thing that you said that I'll just stress since we have some time is how important it is for us to now work on what does UHC look like in practicality? Because I think that over the years, we've been talking a lot about what UHC is in theory, but now it's time for us to really find out what does it actually look like in the countries once it's being implemented, and really having these kinds of case studies to understand what doesn't work. And in some cases, what works, I think, is going to help us answer that question for a lot of countries. So thank you, Ravi, and I'm sure we'll circle back to you with questions during the Q&A. I now have the same question for Kurt. So Kurt, in Argentina, how did you put UHC on the political agenda? And what were some of the successes that you experienced, challenges you faced, and again, some of the lessons learned? Over to you, Kurt.
Good morning to everybody from Argentina. Thank you very much, Eliana. Thank you very much, CSAM, for preparing this interesting issue that for the first time we tried to make some thoughts, to put some thoughts together about how UHC, how civil society has been influencing the Argentinian government for elections. You know that Argentina has a healthcare system which more than 90% of the people receive health assistance from the public government system or from the workers' unions. Only around 10% of the population is privately served, but all three subsystems guarantee since 2003 a general medical program that defines which are the essential healthcare services that have to be freely provided to everybody. The objective is that everybody has guaranteed the access to basic health. This is technically a universal healthcare program. Problem is that the system is not always very efficient and that certain populations are excluded because of stigma and discrimination. Can we pass to the next one, please? I would like to, the next slide, please. I would like to speak a few words about Fundación Huésped. My organization, Fundación Huésped, is an Argentine organization with regional reach that since 1989 has been working on public health areas with the aim of guaranteeing the right to health and disease control. Our comprehensive approach includes the development of research, practical solutions, and communication related to public health policies in our country and in the region. We actually focus on HIV/AIDS, viral hepatitis, vaccine-preventable disease, and other transmittable diseases, as well as sexual and reproductive health. But our main work is to work for a society free of stigma and discrimination, in which all people have equal access to healthcare and where public health policies are based on scientific evidence. And we have been very active, proactive, I would say, in many of the advancements that have been reached in Argentina. The next, please. The last decades, civil society has promoted and achieved many regulations that have an impact on UHC, such as in 2010, since 2010, we have an equal marriage law. Since 2006, we have a comprehensive sexual education. In 2012, gender identity law. We have recently in 2020, had a law concerning voluntary interruption of pregnancy. And very recently, last year, has been in 2022, the actual law for AIDS that was originally from 1989 was actualized, and now we have a law on comprehensive response to HIV, viral hepatitis, and other sexually transmitted infections and tuberculosis, which also contemplates all the social aspects. These regulations, in which our organization has been also very active and civil society have fought for, have improved life quality, helped in reducing gender-based violence, and also provide an updated framework that seeks to eliminate stigma and discrimination for the LGBT plus community and people living with HIV. Next, please. In 2019, before the election, we conducted a survey of candidates in legislative positions throughout the country to understand their stances on various topics addressed by the organization. When asked about abortion rights, 40 out of 53, almost 80%, agreed on strongly that the voluntary interruption of pregnancy should be legal. The bill was then enacted, as I mentioned before, in 2020. Now, here you have the map, how it was. It is in Spanish, but anyway, 80%, almost 80% of the people were agreed on, or strongly agreed on the interruption, that it should be legal. No? Voluntary interruption of pregnancy should be legalized, and the right for every pregnant person to decide whether they want to continue with the pregnancy. That was the idea. No? But now we are getting into a new period. We have had new elections last month of September, and the Argentine new government, next please, that took office in December 2023. Can you pass the next slide, please? Proposes an agenda that openly threatens many of these agendas and achievements. The vote was driven by the need of economic changes. I don't know if you know, but we are in the top 10 of inflation in the world, even much more than other countries that have much bigger problems really than Argentina, that are in war or that are suffering big climatic changes and so on. We still have a higher inflation that was around over the 200% last year. And that means that the vote reflected, really that people needed or wanted some economic changes, especially considering that half of the population is living below the poverty line. In a country that is very rich, really, and that has all the possibility of providing food for 300 million people, we are having half of the population with hunger, and the population is only 40 million, 40 or 45 million. Even though rights related to healthcare may be affected, such as potential setbacks in comprehensive sexual education, voluntary interruption of pregnancy, or LGBT rights, the priority is solely placed on the need of economic changes. From then, we have done focus groups at the foundation, and from that analysis, we have found out that they are willing to accept restrictions on democratic rights which affect access to healthcare in exchange for economic stability. It's complicated because those changes will take more than a few months. And in the meantime, we are having a huge inflation rate every month, and many people are falling in stress and hunger the whole time. You know? We are currently facing a number of challenges. And in this situation, we believe it is essential to ensure that the rights achieved that amount to a real universal healthcare system are guaranteed so that nobody is left behind. But it won't be easy. It won't be easy, and we are having in front of us 2 years of very difficult time. Thank you very much.
Thank you so much, Kurt. I think one of the takeaways that I got from this is how well you all research your environment in Argentina with a lot of the surveys and the results that you shared with us. And I think that's really important because, as everybody here has experienced over the years, especially with COVID, the social and economic and political environments change so quickly. You can go, and I'm here in the United States talking about political environments changing so quickly. So I think, as you know, one lesson learned or that I'd like to share with you all is how important it is before you even start your advocacy to really understand what that political, economic, and social environment is in your country, so that you know what are those challenges that you're about to face, and how are you all going to tackle those challenges if you're in a political environment that maybe doesn't enable some of those rights that you've been talking about, and that even in the past your country might have, but coming up it might not be so easy for various reasons. So I love that you stress that, and I think it's really important for everybody here that's doing advocacy in your own countries to make sure that you're not doing it in a vacuum, and that you're speaking to what's happening and what people are facing on a day-to-day, and also the political environment, who's in power right now and what's important to them, and how can you change that. So thank you. I'm sure we'll come back to you, Kurt, as well with questions. Now I am going to go to Smita. So Smita, can you also please share your experiences in India? And I know that you're going to share a manifesto that you and your organization worked on, and I'm just curious to hear more about that and what were some of your main drivers of success. So over to you, Smita.
Thank you, Eliana. Before going into the manifesto, actually with the election agenda, we worked on multiple angles. First, from 2015 onwards, we have been, advocating with the Election Commission of India towards the data of persons with disabilities and also towards accessible voting facilities. So, the Election Commission have been coming up with different circulars on facilitating voters with disabilities, which is very important for us to be visible with the election agenda and with the, voting, because voting ultimately evaluates the leader and the we also worked out the data of persons with disabilities registered with the Election Commission as voters with disabilities. So with that advocacy, recently what we found is now we have nearly 10 million persons with disabilities, voters with disabilities registered as identified voters with disabilities with the Election Commission of India. So we are vote to all the political and we are also
Smita, sorry, I'm just going to stop you quickly. Smita, do you mind coming off video, because your connection is cutting and I want everybody to make sure they can hear you, and I'm wondering if the connection will be better if you turn your video off. There you go. Okay.
Oh yeah. Thank you so much.
Over to you. Okay.
With 10 million, vote bank, and we also are promoting like our families, friends, and our colleagues working in the disability space, and also the senior citizens and people with rare diseases who have, health needs and facilitations as we require. Then the vote bank is huge. Nearly, the 30 to 40% of the population is, are persons with disabilities and our friends, our allies. And with that message, we are approaching the political parties. And on the other side, the second angle is, for the past, more than a couple of years, we have been emphasizing on the UHC advocacy, and we have started the UHC India campaign, and we are focusing on key messages by the leaders, by different experts from research field and from different other areas, domains like disability leaders or the politicians, and thereby what we made is like we made it visible in the social media that political parties are also taking stock of these key messages from the social media. And we also sought the support of member of parliaments And I facilitated my own member of parliament from my own constituency to be the UHC Day champion. We made her UHC Day champion scorecard, and we had a few MPs coming up and giving out statements on UHC, and which was posted in their websites. So these kind of promotions and facilitations helped the disability movement to gain momentum with the UHC. And apart from that, we also focused on the data of persons with disabilities in all health policies, and we took the support of MPs to advocate towards data of persons with disabilities in the health policy. And next step is now elections will be announced anytime, this week, next week, and we have the elections in 2024, and all political parties are geared up towards that. And now very soon all the political parties will be publishing their manifesto. So what we did is, from the disability movement, we came up with a manifesto, and in that manifesto we identified some 10 key aspects, like 10 key areas with regard to social security, education, employment, the climate change, and one of the key areas is health. And we got inputs from nearly 10,000 people with disabilities and their allies, and towards framing up this manifesto. And NCPDP, an umbrella organization working for persons with disabilities in India, facilitated this process. And we came up with these 10 key areas. And with the health, what we, we gave the statement that, yes, World Health Organization has estimated out-of-pocket expenditure as high as 65% in India, and, which is very high when compared to other countries. And this expense is even more higher for people with disabilities, because we have additional costs living with a disability, and we have the health expenses are huge, the rehabilitation expenses are huge, and the assistive aids, so all these, and the paramedical expenses. So promoting this, and for the past 2 years, we have also been advocating towards the UHC for persons with disabilities, and we find that UHC is low for persons with disabilities, and especially the health insurance schemes are discriminating persons with disabilities. Even I don't have a health insurance in my country. So we are trying to advocate towards this, and this message is coming out clearly in our manifesto, which we launched very recently. And we have also given specific statement, which the political party can replicate in their own party manifesto, election manifesto. So we have given the statement, by 2029, we will ensure that all private and government insurance companies provide affordable and accessible health insurance policies with inclusive, relevant, and tailored health coverage for all persons with disabilities. Coverage will encompass rehabilitation, orthopedic, and paramedical expenses, as well as assistive technology devices. So when we are giving such a statement, it actually helps the political parties to come up with with their specific statements, and they know that these issues are very key. And we have also launched it and did a press conference, so all the political parties are aware, and parties are also sent this by mail and all that. And simultaneously, what we are, political parties have appreciated it. And apart from that, we are also coming up with a kind of charter of again, health insurance is, the UHC and health insurance is very key. And with this what we are doing, we are planning to get it signed by as many people, as many professionals, and as many resource persons, experts, and from different domains, and also the MPs, the member of parliaments. And once member of parliament sign it, it will be a sign of commitment. Once they come into power again, they would definitely carry out that. Those key demands. So this is how we are working on a multi-pronged approach towards the election, UHC election agenda in India. And yes, we are looking at different aspects which also have an impact on health, like health, security, climate change. So all these have an impact on health, and that is looked at. And I hope that when political parties come up with their manifestos, they will definitely include our agenda, disability agenda, into their manifestos. And also, MPs will take it seriously and have the commitment towards UHC for persons with disabilities. Yeah, thank you very much for the opportunity.
Thank you, Smita. That's all very impressive. And I think for me, what's most important about what I'm hearing from you is that this is something that's been created by affected populations and people who've been affected or who are living with disabilities. And I think that's so important also. We say this a lot at Global Health Council, also at the Civil Society Engagement Mechanism, how important it is for us to put people that are affected by diseases or having certain disabilities in the forefront of the advocacy efforts that we have. And we're always trying to find spaces and ways to elevate their voice, because I think that in many places, there's a disconnect between what politicians see and know versus what's actually happening in these communities. And it's really important to bring those communities together to really speak about their experiences firsthand. And I feel like that's even more impactful than having others speak for them. And I think that all the work that you all have done is just an incredible example of how you've done that, and the power that can bring to the advocacy that we do. I also love to hear about this charter and how you're also making an effort to bring together other stakeholders from across different sectors to come together, to have one voice about the specific issue, and making sure that people living with disabilities have access, which obviously is a huge problem, not just in India, but all over the world. And we really saw this during the COVID pandemic. There was a lot of literature that came out about how COVID impacted people living with disabilities and the lack of care that they received because there just wasn't enough access, simply ramps for people to be able to get to vaccines and things like that. So, making sure that you're also finding ways to bring other stakeholders together to unite as one voice to address some of these issues. So thank you, Smita. I am just checking quickly to see if the Honorable Yonghua arrived. I just want to see if no, it looks like he's not online, so he may not be able to join us today. So with that, I am going to pause now to see if anybody has any questions or comments for our panelists. I see that there has been a lot of discussion in the chat, which is great. Very happy to see that. While we pause for questions, I will say that there will be a Mentimeter quiz that we're going to share with you all. You can answer this as we go through the Q&A, but our question for this Mentimeter quiz is, if you had a chance to speak to your political candidate now, what would you ask them to prioritize on health? And if you can go ahead and just scan the code there and you can provide your answers. After we're done with this Q&A, we'll circle back and see what you all had to say. So I'm gonna pause for a minute to give you all time to scan the Mentimeter. And then also in the meantime, if you have any questions to any of our panelists, And I would say, you know, even if you have questions about the earlier presentation about the election advocacy guide, please feel free to either type it in the chat or raise your hand. And I'm going to keep my eyes on our attendees list to see if I see any hands raised. There is also a link to the Mentimeter in the chat that Laura has shared with us. So you could either scan the QR code or click the link. And the question is there as well. So as I'm scrolling through the chat, Ravi, I don't know if would you mind just coming on briefly to summarize the conversation with Vora? Because I think there's some interesting responses that you gave to her in the chat that I think would be great for you to share with others. Vora had asked Ravi, can you elaborate more on the prioritizing key priorities for health reform? What was the process? I'll just hand the mic over to you, Ravi, and maybe you can share some of your responses. Thank you.
Sure thing, Eliana. Yeah. As I mentioned in the chat and in the presentation, in Kenya, we had just come through a process where the conventional UHC approach, and that was very much backed by the World Bank, was acknowledged as a failure. And many of the subnational governments did it. The national government didn't want to frame it that way. They talked about learnings, but everybody knew that this didn't work. So that created a new ground for creativity. The process, though, is difficult. And what we did was, it took some time, but we found groups that were willing to think outside the box being the health financing as the driver for UHC, rather than the universality and equity or the health aspect, which many of us see as primary health care. Others want to see it in a different way, but we're able to get beyond health financing, which was the main critical point. And just having a few of those discussions, and it took a while to make sure, we have people that, we can form a consensus. We had several meetings, and it didn't mean that we had to agree on everything. Instead, it just meant that we knew that there needs to be another way of doing things, and we don't want to give up on SDG 3, essentially, on making sure that the entire population of Kenya has access to high quality care and is not going to go out of pocket on it. There are other reports that happened in parallel outside of our group, and that was encouraging. There was an independent academic report that advised the National Treasury not to do user fees or user subscriptions for social health insurance, but instead to just fund it from the national tax revenue. And many of us have been saying that in meetings, so it was good to see that reflected in a technical document. We didn't want to focus on that because we didn't want it to be tied to one policy recommendation. We wanted to bring it back to what are the values that underlie a health reform or a new health approach in Kenya, and how would we want to bring UHC into those values and then reshape it accordingly. So that was the kind of discussions we had among a small group of organizations. And to be quite honest, it was slow. And part of it was that we just had to make sure that we agreed with each other and we're building a consensus. And part of it was that no one was funding us to do it. We did it because we believed in it, but not because there was a donor backing us. And even now, a few organizations do have, as part of their advocacy, let's put the rights forward. And they're funded to do that. I think that's fantastic. Not all of us do, but it's good to see some of the money following the values rather than the NGOs following the money. And that was some of the points I made in the chats as well. So then the next step, once we had a small group of the consensus, was to get something down and bring it to other NGOs in the health sector. And in Kenya, we have HENNET, which is the Health NGO Network. It's an umbrella organization. It's got around 100 affiliated CSOs around Kenya, ranging from large international international branches of standard NGOs down to community-based or county-level CSOs. And getting HenNet on board was critical. I think HenNet was also very willing to get in this direction because number one, they saw that that collapse of UHC 1.0 and 2.0, and we knew that 3.0 was coming up. And secondly, HenNet was very important because it's recognized by the Ministry of Health as the go-to. If you want to talk with civil society, talk with HenNet. And that has pluses and minuses. It's good to have a door open in the ministry where the ministry comes to civil society in some way, but it also in some ways becomes a gatekeeper. So we had to keep a background constructive relationship with that network as well. I mentioned Amnesty International. They're not focused on health, but they are focused on rights, and health is codified as a right in the Kenya Constitution. So they very much came on board, and they've actually been dedicating some of their resources for these kind of reforms. And then, as you know, PHM, the People's Health Movement, it's another umbrella of activist civil society. We came on board as well because we were able to mobilize a lot of the community-based groups. And who else? Then there were some others who just joined in on their own, the Health Rights Advocacy Forum in Kenya. I showed, I think, an example of some of the submissions to Parliament. National Taxpayers Association was on board, and their focus is not health either, but they really felt that this is too important, and nobody wants to see if you pay taxes and then it goes to waste. That's not part of their interest. In the past, we've also had the Kenya Health Budget Partnership. They've been very, very productive as well. Does that get to some of what you're looking for, Eliana? And I'm happy to hear a little bit more on the chat, or if we get some questions in the Q&A, and otherwise, we're happy to come back to this as well.
Thank you so much, Ravi. And I do want to just give our other two speakers, Kurt and Smita, just I know it was 5-minute presentations and you all probably still had a lot you wanted to say, but I guess my question to both of you, and if you could just briefly answer this, but you know, what's next? Like we've heard a lot about the advocacy that you've done in the past, but I'm really curious, like what are your immediate next steps? What are your organizations going to be doing in terms of advocacy, whether it's in the lead up to elections or, you know, any particular events? If maybe you could just share some of the upcoming activities. Kurt, I'll hand it over to you and then I'll go to Smita.
Yes, thank you, Eliana. Yes, of course, the 5 minutes break that we had only wasn't possible to put in many other things that I was thinking about, and that has to do with politics in Argentina and the situation of Argentina, because 100 years ago, Argentina was considered one of the most powerful and most important countries in the world. And it happened that for the last 70 or 80 years, we've had different governments which slowly worked in the opposite direction, and we were losing that strong structure that Argentina had. And what we see now that we are having a conservative government that has been voted very, very strongly by 56% of the population, even in provinces where they have no structure at all, but people are a little bit, I could say, fed up with the situation that we were living during these years, that people are empowering themselves the whole time, and that the situation is getting worse and worse the whole time. And in that sense, they voted for something different. Problem that this thing that is different is only focused on economy and not on the well-being of people, you know? And that means that the pensioners especially are losing part of their wealth and to try to survive. And young people don't get work. We have a lot of people that haven't got work, young people, and being one of the richest countries in resources in the world, really, because we have agriculture, we have meat, we have everything, but you could imagine, like not many countries in the world, we don't suffer of climate disasters. And this country that should be really, really very, very powerful has lost its impact in the world, and we are not exporting as much as necessary, and people are not getting regular work. We have more than half of the population working informally, and that means that we needed a change. The truth is that it was needed a change in Argentina, but we are afraid that this change will not be working for human rights. Will only look at the numbers of the economy, and in their fight against inflation, many lives will suffer quite a lot. We are having elections next year, again in middle-term elections, and we'll see up to that time what happens. But
yeah, and I mean, it's just goes.
We are going.
It is, and I mean, coming from the US, we are also in a very complicated situation politically too, and I think it just goes to show that, you know, advocacy doesn't end once an election happens. I mean, advocacy has to be ongoing, and, you know, we have to continue to advocate for things that maybe, you know, we might not get the government that we wanted, but now it's our responsibility to make them aware of the things that they're not supporting and why it's important for them to do so. So that needs to continue.
We have been working, just to finish, just to tell you something else, answering what you mentioned.
Just briefly, yes, go ahead.
Just very briefly, we have been working with all governments since the foundation was founded 35 years ago. We have been working with all the ministers and all the governments, trying to assist them in what had to do with health. And but this time we don't find an interlocutor, somebody to talk to.
Yeah, we're in a very similar position, to be honest with you, here in the US. So I feel your pain. So going over to Smita, tell us, you know, where will you be taking this manifesto? What are the next steps for your organization? And I hate to say, but maybe if you could make it brief, because I do want to give the results of the Mentimeter after this. Thank you.
Right. Thank you, Eliana. So yeah, so we are focusing on the influencing points with the political parties. So what are the influencing points? Basically, the vote bank. We are a huge vote bank, but we want to create evidence for the vote bank, and also, you know, may have more support from the leaders, from member of parliaments, and so advocating towards that, and also, you know, making the visibility more. And so what we are doing is we are floating these manifestos and charters across the social media multiple times, so that political parties cannot miss it. And they know that we are very serious about it, and we will vote only for those who would take our demands into their manifesto. And we are following up with all the political parties as they are, you know, coming up with their manifestos to have the visibility agenda, to have our points, the statements into their manifestos. Once it comes into all the parties' manifestos, whichever party comes into power, they would definitely do it. So that is a strategy, and we are also we will also be following up post-elections, like with the MPs and also the governments on our agenda, because this is not just a simple agenda or just one organization's agenda, but more than 10,000 people have inputted on this, and it is the agenda of the entire disability sector and the vulnerable communities from the country. So the government can't go easy on it. So that is how we are trying to push it even post-elections.
Great.
Yeah.
Well, thank you so much to our speakers. I am now going to go ahead and take a look at the Mentimeter so that we can see how you all responded to the Mentimeter questions. So I believe that the responses are going to be projected on the screen. Let's just give it a minute. And just as a reminder, the question was, if you had a chance to speak to your political candidates now, what would you ask them to prioritize on health? Okay, so we see quite a bit here. Financial protection, huge and very important, obviously, when we're talking about universal health coverage, primary health care, an immediate stepping stone to UHC. I'm skipping around here, but equity and social justice, which our panelists talked a lot about, equitable spending on health budgets, prioritizing maternal child health, access to treatment, cost benefits are no longer a fundamental argument. They need to think about social cost and investing. So yeah, really showing, you know, the cost of health, but also the benefits of investment. That kind of data is really important as well. Promote not-for-profit solidarity based on health insurance, people-centered digitalization of healthcare, fair prices of medicine, health and all policies. So these are some really great responses. Thank you for those who participated. We have a few more. Making a UHC policy that would make you confident to send your children to a government health facility, very important. It's not enough to say we implemented UHC, but it's important that the services are efficient, they're of quality, they're respectful. And I know someone in the chat was talking about having UHC in their country, but it not being very efficient and effective. And that's certainly not what we want. So again, thank you very much for these responses, and to our panelists for the wonderful discussion and for all of your experiences and insights. I'm now going to move us to the final portion of our program. I'm going to turn it over to Waiswa Nkwanga. He's the coordinator for the Civil Society Engagement Mechanism of UHC 2030. And he's going to provide you all with some information and data from the most recent UHC 2030 State of UHC Commitment Report, hoping that you can use some of this information in your ongoing advocacy. Waiswa, the floor is yours.
Thanks, Eliana, and thanks all the wonderful speakers and contributors to the Mentimeter. It's been a great conversation and exchange. So we're going to quickly touch on how we can use evidence to support our advocacy. It'll take about 5 or so minutes. As advocates, it's really important that we have the right information on our fingerprints when approaching decision makers, whether that is during elections or in other moments and spaces. I'm going to, can I share my screen here? I'm going to share my screen here and walk you through a resource here. Do you see?
Yes, we can see your screen.
My, okay, great. So, you know, there are quite a few resources out there that provide different kinds of information. But today, I want to show you a little bit about the state of the UHC commitment review that is published every year by UHC 2030. And it provides a global synthesis of progress made toward achieving UHC. And it has several components, including a synthesis report. We have stories and other resources. But for this presentation, I'm going to zero in on the country profile dashboard. And this is because this is one of the questions we get from advocates frequently, is about how they can use or find data to use in their advocacy for their specific countries, their specific issues. And so we thought that it would be good to look at this resource, because there are some useful information that can be helpful to you all. The dashboard provides data on 139 countries, and not all, all UN countries, but 139 is pretty decent. And this data is collected from various sources, including from policy reviews of national plans, health plans and strategies from the voluntary national reviews, from the multi-stakeholder surveys that UHC 2030 does every year, and from country consultations with civil society, as well as media resources. And we collect this data, we analyze it based on the key commitment areas in the UHC political declaration, key targets and commitments, and some of the follow-ups. And so let me just quickly walk you through this, and so I can show you the different components of this country dashboard. So here you get this display, this one, that shows you the distribution of political commitments across the 6 commitment areas. So you have political leadership, regulate and legislate, and quality of care, leave no one behind, moving together, invest more, invest better. And by looking at this, you can see the gaps visually in how a particular country is doing. And we will look in a second, we'll look at an actual example of a country. And then down here, you get to see the averages of other countries of similar income levels as the country that you enter here, and how they compare. And then on the side here, you get a breakdown of political commitments over time. And they're broken into political will, institutional reform, implementation. It shows you what has been done. And then below here, you look at how the country UHC targets and milestones also are coming along. So it's so this is the first part, and then the second part down here, you get to look at progress on global UHC indicators, on service coverage, and on financial protection. It shows you the investment priorities for the country, how it's spending overall, how it's spending on primary healthcare, on out-of-pocket spending. You can see it there. And then down here, down here, you can look at learn about the institutional efforts to achieve UHC. You can look up any country here, just scroll down here and you see the country and what they have done institutionally. And below here, you get more details on what are the priority areas, about what services are more prioritized, what populations are more prioritized. And as you continue going down, you then come this public perception and social participation. And this is really looking at how government is involving different groups and in the healthcare sector, and especially looking at women's participation and leadership in the health sector, and then the multi-stakeholder engagement here. So I will try to show you an example here of a country. Do you still see my screen?
Yes, we see your screen.
Great. Of a country, Kenya, for example. You type in a country, or you scroll down here, get a country, boom, and then it generates this graph for you, all these graphs. And as you can see, things are quite distributed, quite well distributed here in terms of bringing people together, multi-stakeholder engagement, in terms of quality of care, political leadership. But right here, you can see, for example, that a lot of it was done in 2014. There was a lot of institutional reforms. And so you can see that across over time. We don't have much here yet because sometimes data is not in the right time, but we update this periodically, and you're able to see how countries are performing. And again, down here, you can scroll to see by year what was done in terms of the targets and milestones. When you scroll down here, you can look and see which health services are prioritized. So here you can see huge, priority on MCH, maternal and child health, and then a little bit of less on service capacity and access. And then on spending, obviously here you can see that Kenya is not doing as great. I mean, we have recommended 4% in the action agenda. We recommended 4%, and this is below it. But it could be, you can see that there's more steady, remain the same flatlined for a very long time. So this goes on to look at also the populations, and here you're looking at what governments say and then what non-state actors say. And for this country, you saw a lot of mismatch here. You see that they say, the government says that it has big focus on vulnerable populations, but when you talk to non-state actors, they're saying no. And so you have to look at this data more carefully to see what is coming out of government and what is coming out of non-state actors. And then on social participation and especially the involvement of women, you can see that there's some progress there, but not where Kenya would like to be. Well, data is a little bit behind, so I don't know where exactly things are today, but you can see that the women are more in the nursing area, but not in the leadership places. So what you do then with this information is to help you, you use this to help shape your asks for a political leader, for a political party. You now know what's going on in terms of women's participation. You know what's going on spending. You know what's going on in priorities in terms of which areas the money is going, and then investment overall in health. And you can use that information to develop your asks, your messaging specific to your country, using this tool. And I'll stop there. I know that we don't have as much time left, so I'll stop there and see if anyone has any questions. Yeah, back to you. Oh, actually, just to mention that there are other resources, actually. There's also the Global Monitoring Report for UHC that is published every year by the World Bank and WHO, and it tracks SDG indicators 8.31 and 8.32 on service coverage and social protection and out-of-pocket spending. And so you can use that alongside this and get some really robust data you can use alongside other tools that are developed at regional levels, at the country level, to shape your advocacy. Yeah, back to you, Eliana.
Thank you so much. And that's just to say, this is just the country dashboards of the State of UHC Commitment Review. There's also a narrative that provides a lot of global level data that I think is really useful. So I encourage everybody to take a look at the 2023 report, which is the latest report. And I don't know, Laura, if you have a link to it. I actually do, so I can put that in the chat. But yes, definitely take a look at that information, and always good to use data and evidence in your advocacy. So hopefully this will be helpful. I just want to say thank you to everybody who's stuck with us throughout this whole presentation. I know it was a long event, and I hope that you found it useful. I want to give a special thanks to our panelists, to Paloma, to Waiswa, and the CSEM team for organizing this. And I bid you all farewell. I hope you all have good days, good evenings, wherever you are in the world. And I will just ask the panelists to please stay on. Thank you, everyone.